Today we are doing a PRP breast lift, and PRP stands for platelet-rich plasma. So I've already drawn our patient's blood, I've spun it down, and I have got 4 syringes of PRP, and I've got 4 syringes of her platelet-poor plasma. Because even though the platelet-rich plasma has all the platelets, it doesn't have every single one. And if we have some extra serum, let's use it, because there's still great growth factors and cytokines and signaling factors in that platelet-poor plasma. So that way it'll help to signal to her own stem cells to migrate to the tissue where we are injecting, and will help her make brand new breast tissue. So that is the whole goal of the PRP breast lift. You can increase the size, 1 to 2 cup sizes. I never promise that, but it's going to give her a bit of a lift because it's going to be brand new breast tissue up at the top of her breast. We're going to go ahead and begin. I'm going to inject a little of the PRP. You ready? I'm going to start right over here. I just wiped off her numbing cream. 1, 2, 3. Ooh la la. And I'm going to inject some of the PRP right here. And this is so a little bit more cleavage. I'm just going to inject a little bit up higher just to help with these little lines across here. Not really part of this breast lift, but it'll be good for your little lines across here. So I'll just do a little bit up there. Okay, it's a little added bonus. We can go wherever we want. Okay, so we're going to continue with the breast lift. You doing all right?
Mm-hmm.
Excellent answer. Okay, so now we're going to inject again. 1, 2, 3. Good job. Excellent, you're doing great. Super easy. So sometimes what people will do with this treatment is they do combination treatments, which if you've watched any of my videos, you know that I love. So some combinations that work with PRP breast lift would be doing Scarlet, which is a microneedling radiofrequency device to help with the skin tissue and help lift the skin itself. Sometimes with the PRP, people put fillers in, so you get, because in 3 or 4 days, the PRP is going to be absorbed, and so she won't see it as much, but if you put fillers in, it will stay there, and as the fillers break down, the PRP is kicking in, so it's an immediate lift, and it stays for a while. So you could put filler in. You can also put PDO threads, which are pieces of material that physically pull up the breast. So there's a lot of options. If there is a specific height or size you want to be, then this is not for you, because I can't predict what your exact results are going to be. However, this is a great thing if you are never going to undergo surgery, but you just want to have, again, a little bit of a boost. This is a great procedure to do because there's no risk. I mean, she can go back to work today, right after we're done. So the longest part of this treatment is the numbing time. And after the treatment's done, she will go back to her regular activities. She's gonna feel kind of full because I've put a bunch of fluid into her breasts. But I always recommend that people wear a sports bra. And one that clips in the front is a little easier to deal with in case it's a little sore from the pokes. But besides, maybe a little bruise, sometimes people get a little bruise, but she doesn't need to do anything specific afterwards. 1, 2, 3. She can exercise regularly. She's not going to have any kind of drains. She doesn't need to wear any special garments. So it's, again, she doesn't have to take any time off of work for this, other than the time it takes to do the procedure. So it's really a pretty simple thing if you want to. And regenerative medicine, which is what PRP is definitely getting better and better. We just went to the aesthetics show, and basically the entire show was about regenerative medicine, which was PRP, PRF, and all of that. So we are on the right track with using our own body to improve our body. And that's it for this breast. we decided on our patient today that we didn't need to go lower than where I just was because she's got great fullness down there and she's really wanting to pull up here. So that's why sometimes with patients I will do the lower part of the breast, but for her we are not going to. So we can individualize the treatment. And you can see she's not going to bruise. It's going to look great. And we're going to go to the other side. Okay, here we go. Okay, so 1, 2, 3, here we go. So we're going to do the PRP again, right here. I'm going to go a little bit towards the middle to help with that skin again. I'm going to do a little across these lines too, just because we're platelet-rich plasma is good for the skin in general. Okay, platelet-rich plasma again, here we go. And you're doing great. You know, I don't know that there's any contraindications to doing platelet-rich plasma. Sometimes when people have autoimmune diseases, you cannot predict what the results will be because it's very hard to say. Although it's not a contraindication, the results may not be as impressive. What I don't want you to do after this procedure is I don't want you to take a bunch of anti-inflammatories because we want the inflammation, we want the stem cells to come to where the platelets are and start making new breast tissue. So for the next week, no prednisone, which people generally are on, no ibuprofen, which sometimes people take. So Tylenol is the way to go for the next week. All right, here we go. 1, 2, 3, last one. Is that numbing cream pretty good? You feel? Okay, good. I guess some contraindications would be if you were undergoing chemo or something like that, you wouldn't be doing this. We could do this even with breast implants in. So sometimes those breast implants start to get heavy and we can inject above them and bring them up. So even that's not a contraindication. Almost done. And awesome. Perfect. You did great. So she'll leave from here. She'll put on her sports bras. She won't take her ibuprofen for the next week. And then she'll just wait for the platelets to kick in. It can take anywhere from now, mostly the results you start to see about 2 months, but it can take up to a total of 6. And then again, you can always add scarlet to help with the skin, PDO threads to help with the lift, fillers if you wanted immediate volume. So lots of options.